Hi, good morning, everybody. Okay, so a quick one. There is a word you all are familiar with, and when you hear that word, it's fear that comes to your mind. Guess what? Ebola. So when you hear Ebola, what comes to your mind? 2014, right? Where everybody was bathing salt, where everybody was drinking salt, and killed a lot of people. Why did they do that? Because of misinformation. They didn't get the information right. So that's why I want to save you from that. So we are all familiar with the word Ebola, right? Ebola is a very deadly disease. It is a zoonotic disease because the origin is from animal, and it can spread from animal to person, and from an infected person to another person. So why am I saying this? Because there is a latest outbreak of this disease. On 4th of September, World Health Organization officially declared an outbreak of Ebola in Democratic Republic of Congo, in a province called Kasai. The first case was first identified in a pregnant woman, a 34-year-old pregnant woman who was admitted in late August, and she later died 3 days later. It was discovered that it was Ebola. How did it spread? Through spillage from an animal. Around September 14th or 15th, it has been reported that 81 people has been infected and 28 people have died through Ebola. So when you hear that there's fire in your neighbor's house, what do? Start setting your water, because it's definitely gonna get to your house. So that's why I'm putting out this video, because it's in Congo right now, and anything can happen and it can get to Nigeria. What if Nigeria is not prepared for it? What if we don't have the information to avoid it? So that's why I'm making this video. First of all, Ebola is a very severe and fatal virus. It kills, because what it does is it reduces your immune system, exposing you to other diseases around. Second thing it does, that it destroys your blood vessel. And this one is not like a case of hypertension. This one, it perforates your blood vessel, making your blood, instead of your blood to go to the right organ, it's dropping on your tissues. And the thing it does again, it causes organ failure. When blood is not getting to the right vessel, what do you think happens? Your organs start failing. So that's why Ebola is very deadly. So Ebola can be transmitted through any type of bodily fluid, through sweat, through urine, through stool, through vomit, through semen, through breast milk from an infected person. So any type of bodily fluid at all, so you can get it. How is it transmitted again? Through burying people, because they are not protected, they are exposed already, they get it. How is it transmitted again? Through clothes, beddings, or any sharp object from an infected person. So if an infected person is putting on clothes or just touch any place or any beddings, the other person that is not infected can get it, because the person have released bodily fluid on their materials. How is it transmitted again? Through infected animals like bats, like monkey, like antelope. How is it transmitted again? Through infected contacts. Let's say, for example, a person sat down on a chair, infected person sat down on a chair. The uninfected person can get it through touching of door. So this is how you can get Ebola virus. So what are the signs of this Ebola now? So one of them is sudden fever. Start feeling feverish suddenly. Start having weakness, like severe weakness. Start having pains in the muscles. You start having sore throat. You start vomiting. The person start vomiting. The person can start having bleeding from the nose, from the gum, from the skin, even from the skin. You know, I explained earlier that it damages the blood vessel. So instead of blood vessel to be going to the right organ, it's pouring on your tissue, body tissue, and your body tissue can be any part of your body. So that's how you start bleeding from the skin. So you just notice that blood is coming out from your skin, which is very weird. What are the signs again? You start having rash. The signs are similar to malaria, because it exposes you to different type of illnesses. When you notice any of these signs, please call 6232. That's NCDC emergency hotline. Is the hotline. You know what? I tried it this morning around 6 a.m. and they picked. So that means they can pick anytime. So please, you have to cram this number in your head, or have it in your head. 6232. That's NCDC hotline. So if you start noticing any of these symptoms, please call their number. So note that signs and symptoms start having within 2 days. So in the incubation period is 2 days to 21 days. So once a person is exposed to this Ebola virus, so within 2 days now, the person start having most of these symptoms. All of them might not happen immediately, but gradually you experience all of them. So what is the preventive action? What are the preventive measures? What are you supposed to do? First of all, stop hugging people. Stop hugging and shaking people. Brotherly, stop it. Be from far. Twale. I hear you. See, if you see me at work, I refuse to shake you. No, it's because of this video. No, it's because of Ebola. But funny enough, you have to protect yourself and protect others too. Because see, if one person is infected, there's likelihood that everybody else will be infected, because it spread like wildfire through sweat. We where they squeeze inside taxi, so you are likely to get it. So we should make sure it doesn't even get to this country at all, because let's continue. Stop shaking people, stop hugging people, avoid it for now. Then one is hand wash. You have to continuously do your hand wash. Open the door, do your hand wash. Come down from any place, do your hand wash. Like if you touch any surfaces, you go to the bank, please do your hand wash. After shaking people, if you manage shake, do your hand wash. So I think you all should carry sanitizer along, since it's not achievable to be doing hand wash every time. So carry sanitizer that is 70% ethanol or alcohol. So please carry sanitizer. Then how do you prevent it again? Stop eating bushmeat. If you can avoid it, please totally avoid it. If you cannot avoid bushmeat at all, please cook thoroughly. Cook it very well. But my dear, avoid bushmeat. You know that. Avoid it, people. Then the next one is stop eating infected fruits. I don't know what fruit season it is right now, but please, if you go to pick fruits and you notice that a part of it is being bitten by something, whether bird, you don't know whether it's bird or bat, please don't eat it, trash it away. I know us now, it's not this place, I better cut them. Please avoid it totally so that you don't give us Ebola. Don't eat fruit that is bitten or that is exposed by anything. That's another one. Another one is people that is burying people. They should train them. All these people conducting burial should be trained. Another one is this: clean your surfaces. Clean your surfaces. Sanitize and disinfect your surfaces. Then for health workers, please properly dispose your bowel waste. Please. So reduce your visit to the hospital. Stop touching sick people, because you don't know what they are infected with. And if you are visiting the hospital, don't visit the hospital unnecessarily this time around. Please reduce your unnecessary visit to the hospital. If you don't really have a tangible reason to go to the hospital, do not go. I know immigration is working on that. I know everybody's taking action. Let's receive less visitors into this country, especially people from Congo. Okay, so what will you do when you notice any of these signs? Please report immediately to the nearest health care center. If you notice that you start having sudden fever, muscle pain, just please report. I listed the signs earlier. So if you notice any of these signs, please report to the nearest health center. What do you do again? Please do not hide any sick person. And my brother, you don't want me to carry on. All of you will be infected, and you infect others. Others will infect others. Please do not hide any sick person. What will you do again? I told you earlier, call 6232. That's NCDC hotline, and they are picking anytime. I wanted to confirm if it's real. Yeah, this is real. So if it's WhatsApp, you want to call them. If you want to chat them on WhatsApp, or you want to send them an SMS, I will drop the numbers on which you are going to reach out to NCDC. But I think call is better. Thank you.